Hi, I'm Tristan, and whenever we're speaking about using a dynamometer or a pinch grip gauge, the appropriate way to position your client patient in the appropriate setting would be a hospital setting, a therapy gym, or even like a private practice, or even in a patient's room, as long as the equipment is on hand. Using the dynamometer, you would have your patient seated in a chair, like I am. You would like their feet planted on the ground, just 90-90, just for proper posture, and have their hand directly on their side. Have their shoulder directly down to their side and their elbow at 90 degrees flexion, just like this. And you would put the dynamometer into their palm. You would adjust it depending on their grip size and the size of the hand of the patient. And whenever they grip it, you would make sure that the gauge is set all the way down with its dial, that it's all the way reset, and we would measure in pounds. You would have your patient squeeze as hard as they possibly could, and then you would check the dial, you would record the results, and reset it, and you would do that 3 times for the affected hand that you are measuring. That's going to show the ability to be able to find the mean of all of the averages of strength for that specific hand. Whenever we're speaking of a pinch gauge and we're going into the positioning for that, it's going to be the relatively same circumstance, seated in a chair, proper positioning, just 90-90-90, and have them as well, hands straight down, and whenever they go to grab the pinch gauge, it measures in pounds as well. You want to make sure that the dial is always set back before doing the assessment with your patient. They would either have the lateral key grip pinch, they would have the 3-jaw chuck, or the tip-to-tip or pincer pinch. And each one of those, they would squeeze as hard as they can. And then you would find the averages out of those as well. And that's how you do those assessments. Thank you.